I'm Maggie. I'm a student nurse practitioner. Today I'm going to be completing a head-to-toe assessment on you, if that's okay. I'll explain the systems as we're going through and what I'm doing. I'm going to start with assessing your skin, hair, and nails today. Your skin looks tan, looks warm and dry. You look clean, and your skin tone looks even throughout. I'm going to take a look at your arms. Your texture looks even. Skin turgor looks normal. You have good elasticity. I don't see any lesions looking at your skin. Do you have any wounds that aren't healing?
No.
Okay. I'm going to take a look at your hair. Your hair is thick and dark, evenly distributed throughout your head. And your nails, can I take a look at your nails? I don't see any clubbing. Your nail bed measures about 160 degrees. It looks normal. I'm going to move on to your head and scalp. Your scalp looks round, feels round and symmetrical. Again, I'm not feeling any lesions, not feeling any bulging or masses. It's normal in size, no trauma to your head.
No.
Your facial shape looks symmetrical in relation to your skull. Let's see. I don't see any facial tics. Your pigmentation looks normal on your face. And I'm going to go ahead and palpate your sinuses. Tell me if you feel any pain. Any pain here? Great. And any pain here? Okay. Also going to palpate your mastoid process. Any pain here? So mastoid process is without tenderness. Your scalp is symmetrical, and I don't see any facial tics. With your neck looks symmetrical. Go ahead and move your neck side to side for me, and move your neck around in a circle. Do it go the other way. Okay, looks like you have full range of motion. Any pain with movement of your neck? Okay. I don't see any masses or skin folds on your neck. I don't see any webbing. Your tracheal position looks midline, and I don't see any protrusions. I'm going to go ahead and palpate your trachea. Go ahead and swallow for me. Okay, and I do feel your hyoid bone moving when you swallow. I don't see any tracheal tugging as well when you move your head side to side. Scooch forward a little bit for me. I'm going to get behind you. I'm going to just feel your thyroid on both sides. Okay, and I'm not feeling any masses. Your thyroid feels normal in size. Swallow for me again. Okay. Yep, that feels good. Thank you. Any tenderness when I palpated your thyroid? Okay. I'm going to move on to palpating your lymph nodes. So these are your pre-auricular lymph nodes, your post-auricular lymph nodes, submandibular, submental, occipital, sternocleidoid mastoid. We've got your anterior cervical and posterior cervical here. Any soreness in here? Okay, and I've got your supraclavicular and infraclavicular as well. And I don't feel any nodules or any swollen lymph nodes there. Now I'm going to listen. With my stethoscope, I'm going to listen to your temporal arteries for bruit. And the other side. And I don't hear a bruit there. I'm going to listen over your eyelids as well. Go ahead and close your eyes. Both sides. And I don't hear a bruit over your eyelids. I'm going to listen over your thyroids. Okay, and I don't hear a bruit over your thyroids. Now I'm going to just palpate your joint of your jaw. Any crepitus, go ahead and open your jaw and close it. Okay, I don't feel any crepitus. We are going to move on to testing your vision. The first thing I want to do is the eye chart. I'm going to stand back here a bit. I'm going to have you cover one eye and go ahead and read the lowest line that you can make out.
LTFPH.
Okay, cover the other eye. Read the lowest line.
LTFPH.
Okay, and you can use both eyes now and read the lowest line.
LTFPH.
Okay, so you have 20/20 vision with the Snellen eye chart. And now I'm going to test your visual fields. Let's test your peripheral vision. So I'm going to have you cover one of your eyes and keep looking at me and let me know when you can see my fingers, how many fingers I'm holding up, okay?
2.
Okay.
2. Oh.
Keep looking at me.
3. 1.
Okay, switch eyes.
3. 1.
Keep looking at me. Okay. All right. So you have good peripheral vision on the confrontation test. Let me go ahead and look at your eyebrows and orbital areas. Use this next. And your eyebrows have thick hair. They look even. They look clean. I don't see any redness on your orbital areas. Your lacrimal gland looks normal. Your sclera look white. I'm going to go ahead and pull down your eyes. Look at your conjunctiva. Pink. Your corneas look clear. No arcus in your corneas. Keep looking at me. I'm just going to shine a light in your eyes. Pupils are about a 3 and reactive to light. I'm going to just bring this towards you. Keep looking at me. And reactive to a combination. No afferent pupillary defect that I saw, and no nystagmus. Keep looking straight at me. Okay. And again, your lacrimal glands look normal bilaterally. They're moist. I don't see any redness, no swelling in the glands. I'm going to have you just cover, I'm going to get out of the way real quick. Cover one eye and look at this mirror back here. And then switch to the other eye. Keep looking at the mirror. Switch to the other eye. And then switch back for me. That's just the cover-uncover test. I don't see any eye movements. And then I'm just going to check your fields of gaze here. So just follow my finger, okay? Good. Okay, good. So I don't see any extra eye movements. You were able to follow my finger. You passed both of those tests. I'm going to look at your eyes with my scope now. Actually, I'm going to I'm going to start with this eye. Come in real close, okay? Alright, so the lens is clear. I do see the red light reflex present. My light. I'll check the other one too. Lens clear. Red light reflex. And I'm going to look without my glasses so I can see better. Okay, look right at the light for me. Okay. The retina's a red-orange color. Go ahead and look at the light again. I see the vessels, the veins are slightly larger than the arteries. I don't see any AV nicking or cotton wool spots. And I don't see any lesions. Anterior chamber is about 3 millimeters. The macula is oval, it's pigmented. Everything looks good there. I'm going to move on to testing your ears. First, I'm just going to inspect your ears. They look normal in size, color matches your skin tone. They are in a symmetrical position on your head. Just palpate around your ear. Any tenderness when I do that? And on this side? Okay. There's no swelling or nodules or deformities on the outside. I'm going to take a look inside the ear canal. Ear canal is clear, no discharge. Little amount of earwax. I can see a tympanic membrane. It is pearly white and shiny. I don't see any perforations. I don't see any lesions or masses. Look at this here. There we go. Going towards the end. Same thing on this side. Clear ear canal. No discharge, no lesions, no foreign bodies. Pearly white eardrum. No perforations. We're going to assess your hearing now. I'm going to put this tuning fork in the middle of your skull. Tell me if you hear it equally on both ears. Both sides? Okay. Now we're going to do one side at a time. Let me know when you stop hearing it, and then let me know when you stop hearing it a second time. So air conduction is longer than bone conduction. We'll do this side. You'll hear it. And air conduction is longer than bone conduction on that side as well. Now I'm going to do a whisper test. I'm going to back up a little bit. I'm going to have you plug your right ear. I'm going to whisper a word and tell me if you can hear what it is. Plug your other ear. Christmas. Okay. You got both of those correct. I'm going to move on to your nose. So looking at your nose, it's normal size. It's pinkish tan. I don't see any masses or lesions. I'm going to take a look inside your nose. I don't see any bone displacements outright. Alright. Your nares look patent. Your mucous membranes look pink and moist. Your septum looks aligned, centered. And I don't see any discharge. We felt your sinuses before. Again, I don't feel any swelling of your sinuses. So that's it for your nose. Moving on to your mouth and throat. Your lips are pink and symmetrical. They don't look dry or chapped. I don't see any cracks. Could you open your mouth for me? I'm going to look at the back of your mouth and your tongue. Stick out your tongue. Right, look up. Say ah. Okay. Put your tongue back in. Open again for me. Just looking at your gums. Your gums look moist. I don't see any gingivitis. Your tonsils look good. They're not enlarged. Your tongue looks pink and moist. No ulcers on the tongue. Your teeth, I don't see any missing teeth or chipped teeth. There's no edema to the tonsils. The uvula is centered. It's pink and intact. We're now going to move on to your chest and lungs, and then your heart. We'll just take a look at your chest. You can just breathe normally. Could you cross your arms over your chest for me?
Yes.
Yep. And then go ahead and put your arms out. Okay, go ahead and relax your arms down to your sides. So just counting your respiratory rate. It's about 16. It's regular. I don't see you using any accessory muscles when you're breathing. I don't see any barrel chesting or tripoding. You're breathing normally. Your AP lateral ratio is 1 to 2. That's normal. Your thoracic expansion is symmetrical. I'm going to go ahead and behind you, some supplies. Could you just angle yourself that way a little bit? Just your whole body like this. Okay. Okay. So take a deep breath in and let it out. Okay. Your thoracic expansion is symmetrical. And I'm feeling, I don't feel any crepitus. I'm going to have you say 99 nice and loud every time I move my hands, okay? Go ahead, start.
99, 99, 99.
Good. Now I'm going to have you do some breathing and I'm going to do some measuring. So first I'm going to have you take a deep breath in and hold it. And then I'll let you know when you can let it out, okay? Go ahead and breathe in. Hold it. Okay, let it out. Okay, we're going to do the other side. Take a deep breath in. Hold it. Let it out. Okay, this time, go ahead and breathe normal. This time I'm going to have you take a deep breath in and let it all out, and then you're going to hold it with all your breath out. Ready? Okay, breath in, let it all out, and hold it like that. Okay? Breathe normal. We're going to do it again. Take a deep breath in. Let it all out. And hold it. Good. Alright, you can breathe normal. I'm just going to measure this. It's about 4 centimeters on both sides, which is great. That's your diaphragmatic excursion. Okay. While I'm back here, I'm going to go ahead and listen to your lungs in the back. You can just breathe normal. If you can, take a breath every time I move my stethoscope. Just a little one. Listen on the sides. Okay, and then this time I'm going to listen while you say the words blue moon. Every time I move, just repeat blue moon for me.
Blue moon. 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 Blue moon.
Perfect. That good. gets quieter as we go down, which is normal. Okay. And then just finish listening to your lungs in the front. You have clear lung sounds all around. I don't hear any extra sounds. No wheezes or crackles at all. I'm going to move on to your heart. If I could have you just kind of angle this way, but still be sitting on the edge here. And then I need to come over here. So I'm just going to take a look at the precordium. I'm going to use this for my lighting. I'm going to stand to the side over here, kind of just looking at the chest, looking at the sternum, the apex, the substernal notch up here, the angle of Lewis, and the sternum here. I don't see any pulsations visually. I don't see any heaves or lifts, just looking with my light. I'm going to go ahead and have you lay back here now. And then just with your head on the pillow, put your feet out this way. Okay, I'm going to palpate the apex. You feel the apical impulse here, and then actually if you could turn on your left side real quick for me too. And I'm going to reach down to that same spot. Okay, and I can palpate the apical impulse there as well. So come back on your back for me. And I'm going to feel for thrills. I'm going to feel on the left sternal border, the base of the heart, my palm, in the apex. And I don't feel any thrills. I'm going to go ahead and listen. I'm first listening with the diaphragm of my stethoscope. I'm going to listen to the aortic, pulmonic, Arc's point, tricuspid, and mitral. And then I'm going to do them again quickly. I'm going to have you hold your breath real quick, okay? Take a deep breath and hold it. Okay, and I don't hear any murmurs or any extra heart sounds. I hear S1, S2, I don't hear an S3 or S4. And now I'm going to listen for murmurs with the bell of my stethoscope, and you can continue to breathe normally. Again, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. Okay, and I don't hear any murmurs with the valve. I'm going to go ahead and inspect the abdomen while you're laying here. Inspection of the abdomen, it looks even. I don't see any lumps or masses. There's no motion on the surface. It looks symmetrical. No evidence of hernias or muscle separation, just on visualization. I am going to listen in all quadrants for vowel sounds. Starting with the right lower. And I do hear active bowel sounds. They're not hyperactive, just active and not hypoactive. I hear them in all 4 quadrants. Now I'm going to take a listen to the arteries around your abdomen. I'm going to do that with the bell of my stethoscope. First, the abdominal aorta. Renal artery, and right renal artery, and left iliac artery, and right iliac artery, and left femoral artery. And I don't hear any bruise in those arteries. Now I'm going to go ahead and percuss in those quadrants as well. Start down here. Okay, and I hear tympani over the stomach. I'm going to percuss the liver borders. And I'm going to need a tape measure. You okay? Alright, you're just going to feel me tapping on your chest. Mark right here where we switch from resonance to dull, and then do the same thing starting down here. Here. Switched from tympani to dull right about here. If we measure your liver span, it's about 8 centimeters, which is average. I'm going to percuss over your spleen and your gastric air bubbles. Also, your spleen's over here. And I hear that tympani sound over here too. And then we'll do your gastric. You hear that right there. Your gastric air bubbles, tympani. Now I'm just going to palpate lightly in all quadrants. And you told me if you have any tenderness, okay? Any tenderness here? Okay, what about when I push and release here? Anything? Any tenderness here? Anything here? Anything here? Okay. And I don't feel any masses or any muscle resistance when I push. I'm going to push a little bit deeper now. You let me know if I'm causing any pain. Okay. And do around your belly button. Your belly button. I'm not feeling any bulges or masses or hernias around the belly button. Any pain there? Okay. Palpate. Go ahead and put this arm up for me. I'm going to try to palpate your liver. You can maybe feel the very edge of your liver border here. Is there pain there? Okay. All right, and then this side, I'm going to try to feel your spleen. And I can't palpate your spleen on this side. And then I can't feel your gallbladder either. I think that's going to be too deep. I'm going to go ahead and palpate your kidneys. But just put your arms up for me. I'm going to reach behind you. Okay. And I did palpate your aortic pulsation. Yep, and I can feel your aorta pulsating there. I did not palpate any other masses when I was palpating. I am going to have you sit back up on the edge so I can get a better feel of your kidneys. Okay. And you let me know if there's any pain with this, okay? Any pain? Okay. Side. Any pain? Okay. All right, that is it for abdomen. I'm going to take a look at some of your blood vessels on your extremities. First, I'm just going to take a look at your arms and legs, and we're going to look at your peripheral veins and arteries here. I'm seeing that your skin on your arms and legs is tan. Your hair is evenly distributed. I don't see any varicose veins or non-healing wounds. Your nails look even. No issues there. I don't see any muscular atrophy or edema. I'm going to go ahead and feel your pulses. We'll do your radial pulses together. Brachial. Okay, and popliteal. So this leg. Okay, and this one. I'm getting 2+ for all of these pulses for amplitude, they're regular, his extremities are warm. Rate's about 75 for all of his pulse. Looking at venous sufficiency, the skin texture is good. There's no nail changes. There's no edema. There's no pitting edema when you palpate. He's warm. He has good capillary refill. I'm going to go ahead and take a look at your jugular vein. I'm going to come to the side. And we're just going to use this light because it's what we have. Can you just lean back on this cushion for me? Keep your bottom where it was. We're going to simulate a 30-degree angle. That's perfect. And I don't see any jugular venous distension. Go ahead and turn your head just slightly to the left. Good. And then let me just feel. Okay, and I feel the carotid much stronger than the jugular. I'm going to go ahead and measure. The jugular venous pulsations were much weaker than the carotid. Measure here to the sternum. And it's got about 7 centimeters. So no jugular venous distension. I'm going to check the other side as well. I don't see any visual distension on this side. Again, I feel the carotid much stronger than the jugular. And if we measure sternocleidomastoid to sternum, it's about 7 centimeters. So no JVD. You can sit back up. Your abdominal blood vessels, we just did with the abdomen section, so we're going to skip that. And we are going to move on to the neurological section. Okay, so the first thing I'm going to test is your cranial nerves. I'm going to have you plug up one side of your nose. I'm going to have you smell something and tell me what it is. You know what that is? Coffee, yep. Go ahead and close up the other side. Tell me what the smell is. Yep. Okay, so the olfactory nerve is intact. Next is your optic nerve, and we just did the cell and eye chart, which your vision was 20/20, and we also did visual fields, which were intact on your visual acuity. For your oculomotor, trochlear, and abducens nerve, you had no nystagmus on the 6 cardinal fields of gaze. That's where you followed my finger. We're still not going to do that again. And your pupils, we can check your pupils again. Go ahead, look at me. There are 3. They're equal, round, reactive to light, and accommodation. For trigeminal nerve, I'm going to touch a couple of parts on your face. I want you to tell me if it's dull or sharp. Go ahead and close your eyes. It's dull or sharp?
Dull.
What about this?
Sharp. Dull. Dull. Sharp. Sharp.
Okay, good. And then also I want to test out your muscle tone of your jaw. So I'm going to have you just open against my hands. Good, so good muscle tone there. For your facial nerve, I'm going to have you open your eyes really wide and close them really tight. Okay, and smile really big. Smile big. I'm going to make sure it's both sides. Okay, and frown for me with your forehead.
No.
Okay, all right. Make a sad face. Pout. A pout. Okay. For your acoustic nerve, we already did the whisper test, which you passed bilaterally. For glossopharyngeal nerve, we would normally elicit your gag reflex with a tongue depressor. I'm not going to do that for the sake of this video, but I will have you give me a cough. Okay, and I've noticed that your voice is not coarse. You don't have any issues with your vocal cords that I've heard. And for your vagus nerve, I'm going to have you open your mouth and say ah. Okay, and your uvula moves when you say ah with your throat vibration. So your vagus nerve is intact. For your spinal accessory nerve, I'm going to have you move your head this way against my hand. Good. And then this way against my hand. Good. So you have good muscle tone in your spinal accessory. And then for your hypoglossal nerve, I'm going to have you stick your tongue out, move it side to side, move it up and down, and then stick it in your cheek and in your other cheek. Okay, so you have good tongue motor movement for your hypoglossal nerve. Next, we're going to check your cerebellar function. I'm going to have you put your hands on your knees, and you're going to flip them back and forth really fast. Good. And then I'm going to have you take your feet, and you're going to touch your knee and touch your shin up and down really fast. With
opposite leg.
Yeah, so use your right like this. Right leg, knee to shin. Okay, and then do the other one, knee to shin. Okay, so you were able to do those movements quickly, without errors. The next one for your proprioception is I'm going to have you stand up and cross your arms. And we're just going to stand, would normally be about 30 seconds. But stand, and then go ahead and close your eyes and keep standing like that. Okay, so you have great balance. You can open your eyes. Next, I'm going to have you walk. Just walk as far as you can, like normal. And then when you walk back, I want you to just walk toe to heel, back to where you were. Walk forward, toe to heel, back to where you were. Okay. So your gait is fine. You can sit back down. Your posture was fine, your arm movements were fine, and you were walking heel to toe. Next I'm going to test some sensory function. So your eyes are going to be closed for most of this section. I'm going to test your recognition of sharp versus dull on various areas of your body. So you're going to tell me if you feel sharp or dull, okay?
Okay.
All right.
Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Okay, that looks good. Now keep your eyes closed. I'm going to manipulate your fingers and toes, and you're going to tell me when I ask if they're up or down. All right?
Up.
No?
Down.
No?
Up.
No? Now,
down,
now,
up,
now,
down,
now,
up,
now.
down.
Okay. Now I'm going to put an item in your hand, and you're going to manipulate it just with that hand and tell me what it is. Open one of your hands.
Close friend.
Okay, and your other hand.
Lighter.
Okay. Now for this one, I'm going to touch you on various parts of your body again and tell me if I'm touching you with 1 point or with 2 points. Okay?
1, 2,
Mm-hmm.
1, 2, 1, 2, 2.
That was good. Now I'm going to have you hold out your hands. I'm going to draw a letter and see if you can tell me what it is with your eyes closed.
T.
Okay, and you do the other hand.
M.
Good. And the last one is I'm just going to use one object and you just tell me where on your body it's touching. Okay?
Elbow.
Which, right or left?
Right.
Okay?
Left knee. Left hand. Right middle finger. Nose. Right ear. Belly button.
Sorry, I didn't tickle you.
Right thigh.
Okay. Last couple of things are some reflexes. I'm going to have you lay down again right here. I'm going to check your abdominal reflexes. Good, so I'm just seeing you react to that. So that's a positive abdominal reflex. And then I'm going to check your plantar reflex here. Okay, so you have a negative Babinski reflex, which is normal in an adult. And then I'll also check for ankle clonus while your legs are up here. So. Okay, so no ankle movements. No ankle movements, so you're negative for ankle clonus. You can sit back on the edge for me. And I'm going to check your deep tendon reflexes. Go ahead and relax your arm. Okay. Checking your brachial. Your brachial radial. Do one more time. So doesn't want to relax your arm. There it goes. Okay, and this side. Your tricep. Your brachial. And your brachial radial. Get that thumb twitch there. There it goes. Okay, have a seat. Alright, if you could get your feet off the ground, either scoot back or, yeah, that'll work for me. And then get your patellar. Okay, and this one. And then get your Achilles one here. We'll Now I'm just going to take a look at your bones and muscles and joints to wrap up our exam. Looking at your skeleton and your extremities, everything looks even. Your muscle distribution looks even. Your extremities are aligned. They're similar in size on both sides. Your skin is even in color. There's no skin folds over the muscles. There's no swelling. I don't see any masses. I don't see any muscular dystrophy. I haven't seen any muscle spasms. So I'm going to go ahead and palpate as we go, and we're going to move all of your joints. We're going to start with your hands. So I'm not feeling any crepitus as I move the joint. On your wrists, I don't feel any crepitus. Okay, so for your hands, I'm going to have you just spread your fingers. I'm going to have you roll your wrists. Any pain with movement there? Okay, and move up your arms, your forearms, and your elbow. Do some range of motion. No crepitus in that joint. Go ahead and bend your elbows. Rotate them a little bit. Okay. Your biceps. Shoulders. Shrug your shoulders for me. Alright, and then I'm going to have you stand up. Cross one arm over the other, and just do that a few times. Your shoulders. Any pain in your shoulder joints? Okay, that's good. Excuse me. We already kind of felt your TMJ joint, but go ahead and open and close your jaw. Any pain opening it? Excuse me. I'm going to take a look at your spine if you'll turn around for me. Just feeling spine. Feels straight. Can you go ahead and bend down a little? I'm going to feel for scoliosis. I don't feel any scoliosis. Any pain? Okay. Now can you bend back the other way? Any pain that way?
No.
Okay. Are you able to twist your spine both ways? Good. All right. I'm going to have you lay down. We're going to do your hips and legs. I am just going to feel your hips. Sorry. Feel your knees, bend them up. Right, no crepitus. Feel any popping or cracking or anything like that. Okay, so to check your hips, I'm going to have you one at a time just lift up a leg. Okay, and do the other one. All right, now I'm going to have you pull up one knee to your chest and then rotate it out this way. Yep, good. Just checking your hip flexors. And then do the other one. And then there's a cushion, but try to go out. Okay, good. All right, and then I'm going to have you stand back up. Sorry. To check your knees, I'm going to have you kick back and then kick out straight on both sides. Okay, do the other side. Okay, any pain in your legs or knees? Right, and then stand with your ankles together. Just going to look at your alignment of your feet and your toes. We've got 5 toes on each side. Your feet are aligned with your tibias. Any pain in your ankles or feet? And during weight bearing, it looks like everything's aligned. But have a seat. I'm going to have you just manipulate your ankle joints and circle the other one. Okay, and then fan your toes. Okay, I do this one. Feel. That is all for our assessment today.
Thank you.
Thank you.